Welcome back to Living Healthy. Our next segment is the Didn't Know That. My guest today is Andrew Doney, owner of Nurse Next Door here in the region. Welcome to the show.
Thanks, Phil.
Great to have you on.
Thank you.
And I want to share a little bit more information as to a lot of misconceptions that people have when getting into the baby boomer age and beyond as to home care facilities and healthcare type facilities. So we'll start with the simple thing. I guess from what Nurse Next Door does, it's more than just providing home care. It's a much greater experience, isn't it?
Absolutely, Phil. What we attempt to achieve is provide a great experience for our seniors. So not only are we providing home care,
right,
but we want to go in and provide a great experience. Just because you're aging doesn't mean you can't enjoy many of the hobbies you have,
right,
many of the things you enjoy doing. It might be gardening or golf or many other things, cooking. I'll give you one example. We have one client who played tennis until he was 91 years old.
Excellent. And
unfortunately, he's lost his eyesight, but we found a caregiver to go in with him each day that enjoys tennis as well, enjoys sports, and she reads the newspaper to him every day, the sports section, and they have a discussion about it.
Excellent.
Of course, we're also providing the home care.
Right.
But while they're taking care of all that, they have things that are in common.
Right. Well, that's amazing.
Yeah.
So it really helps as far as quality of life and keeping up with things that people are passionate about.
Absolutely. And the way we achieve that is I go and do an assessment with each family.
Right.
And find out what the person's personality is, what their likes are, what they enjoy doing.
Right.
That then allows us to find the right match. Excellent. So we don't just send in a caregiver. We find the person with the right personality, the right interests, and we create a really nice experience.
That's beautiful. Good. Now, I guess when we look at that, I always think of home care in years gone by as for seniors. And it's not for seniors only, is it?
No, it's not. Actually, with my locations, I'm also running a new mom and new baby program.
Excellent.
And what that is we're helping moms who come home from the hospital with the new baby, might be having a difficult time. It might be regarding feeding the baby. It might be regarding getting their own sleep. They may need respite care. They may be suffering postpartum depression. I have qualified nurses and personal support workers that can go in and provide that relief that they may need. It might be helping them with the breastfeeding side. It might be allowing them to sleep. But while my caregivers are there, they know that the babies are in good hands and they can rest easy at night.
That's excellent.
I actually have one client who is a quadriplegic who recently had twins.
That's amazing.
And we go in 3 or 4 times a week overnight so that she can rest and know that the babies are safe in our care.
Right. That goes a long way. And looking at what you just mentioned there about persons with special needs like that, you guys can help with that as well.
Absolutely.
For adults with special needs,
absolutely,
respite care and everything as well.
Yeah, we also do palliative care. So
right,
if we have people who are going through cancer treatments, we can go in and help them. We can also help people with disabilities, as you mentioned, in general.
That's excellent.
Any age, any group that may need help, we can help them through their tough times.
It's wonderful to know. Now, looking at protecting yourself, obviously there are many different choices out there. What would you say are some of the top things to always look at when you're choosing a facility, be it home care or within a healthcare facility? Are there certain things that people should know? Yeah,
there's definitely things that the public should ask, things that they should look into, such as, does every employee have a vulnerable sector check? And that's a background check on each individual to make sure that they have no criminal history. That's very important.
Yes.
TB testing is important as well when you have facility workers with many people around. Also make sure that the facility or the home care company's checking referrals. And it can't be a friend or somebody down the street, right, or a cousin. It has to be a previous employer.
Right.
We're dealing with vulnerable sectors. We need to do our homework, and we owe it to these demographics to do our homework to make sure they're safe when they're in our care.
That's perfect. Well, I appreciate you taking the time here. I'm sure we could spend a lot more time going over many more questions here. Very interesting. I look forward to having you back on the show again for more insights on this. Thank you very much, Andrew.
Thanks, Phil. Appreciate it.
Good. It's been my pleasure to share the gift of knowledge here on Living Healthy today. I'm Dr. Phil McAllister, your wellness consultant. Till we meet again, live with passion and keep smiling.